All right. Good morning, good afternoon, good evening, everybody. We are so excited that you are able to join us today for the 12th webinar in the series on responding to the pandemic together. This is part 2 of remote and online education during COVID-19. We're going to be focusing on how-to suggestions so that you can deepen the learning in the specific area that we had spoken about several weeks ago. I'm excited to let you know that this webinar is delivered by FIP Ed, FIP AIM, the Academic Pharmacy Section, Workforce Development Hub, and IPSF. My name is Toyin Tafade, and I'm Dean and Professor at Howard University College of Pharmacy in Washington, D.C. We're so excited to host you today, and I wanted to let you know that we have quite a bit that we have to offer you from FIP. FIP has special webinar series that aim to provide relevant information and guidance for pharmacists, share strategies, and discuss different things that leaders and workers and organizations need during this pandemic. We also try to serve the sectors in the different regions for pharmaceutical science, practice, and education, engage frontline workers, and discuss some of the implications of the pandemic on issues such as safety, supply shortages, and so on and so forth. We want you to please let us know if there are additional ideas that you would like us to feature, and make sure to email Lena at fip.org. Thank you again for joining us, and please visit our website for additional information. It is very important for you to be able to see what up-to-date information is available. We are on Facebook, and this webinar is also being streamed live on Facebook as well. Other information for you to be aware of regarding FIP, perhaps this is your first time joining us in a webinar. FIP is the Global Federation of National Associations representing 4 million pharmacists and pharmaceutical scientists around the world. Our mission is to improve global health by supporting the advancement of pharmaceutical practice, sciences, and education. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and pharmaceutical care worldwide. We're really so glad that you are able to join us. And it's important for you to be aware that this idea actually came from the Academic Institutional Membership, the AIM Forum of FIP. This is the only global network of academic pharmacy leaders, and we have 160 pharmacy and pharmaceutical sciences schools from 55 countries. Perhaps you're not yet a member of AIM. We invite you to join us and find out more at aim@fip.org. We do have a group of colleagues from every region around the world who participate as a planning group, indeed, to advise our fearless leaders, Pierre Moreau and Wayne Hindmarsh, the chairs of the Academic Institutional Membership. This is a group of colleague deans from around the world, and the regions are listed as you can see here. If you have any questions, please feel free to reach out to any one of these wonderful and fearless colleagues. A little bit of announcements and webinar house rules for today. This webinar is being recorded, and it will be freely available at www.fip.org/coronavirus. You may ask questions by typing them into the questions tool. I will be watching that space, and we will take the questions at the end of the call. Your feedback is welcome. We will have a survey that will be disseminated at the end of the webinar. It should be coming from webinars@fip.org. Please let us know your feedback regarding this webinar and any other ideas and comments or suggestions for future webinars that you would like us to be aware of. All right, at this point, it is my distinct honor to introduce you to the lead panelist for a group of colleagues around the world who have really put their brains together to make sure we have a fantastic webinar today. Our lead panelist is Sean Gleason, and she's Director of Distance Degrees and Programs, University of Colorado Skaggs School of Pharmacy. She's also one of the global leads for the FIPWDH Academic Capacity Group. So let's welcome Sean Gleason.
Thank you so much, Dr. Tafadi. Thank you, everyone. It's a pleasure to be here again, and I'm looking forward to following up on our first webinar. So there we go. So as Dr. Tafade mentioned, this has been a work that has been shared among many groups in FIP, and I just want to recognize all of the planning committee members who have helped us in putting together not only this webinar, but our first one as well. And as you can see, they're from the FIP AIM group, Dr. Altieri, Dr. Tafadi, the FIP Academic Pharmacy section, Dr. Schneider, Brock, Malone, Wingate, and Jordan, and then my colleagues on the Workforce Development Hub, Claire Anderson and Patricia Acuna, and then importantly, Emanuela Nezaribe is joining us from the Student Federation. So it has definitely been a collaborative team effort. So our learning objectives for today are that at the end of this session, hopefully you will be able to discuss specific ways that common online pharmacy education challenges have been met. And I just want to, with this, add that much of what we'll be speaking of today are in response to the challenges that were brought forth on the first webinar. With that, then, hopefully you will be able to anticipate and prepare for potential online challenges while also appreciating the potential rewards. And of course, at the end, we will share more questions, challenges, and ideas to address more challenge. Challenge seems to be the word of the day. So let me introduce our several panelists joining us today, and I'll be going through these pretty quickly, but I'll be starting off with two colleagues from Monash University in Australia, starting with Dr. Dan Malone, who will be speaking to us today about promoting academic integrity, among other topics. Dr. Vivian Mack will also be joining us from Monash University. She is one of our three OSCE experts, as well as a simulation expert, speaking about the MyDispense system there. Dr. Rebecca Moles will be joining us from the University of Sydney. She has a variety of tips to share with us on OSCEs, as well as promoting academic integrity. My friend and colleague, Dr. Sarah Schooler from the University of Colorado, will be sharing some great methods of doing OSCEs in a large class environment, and has some creative solutions to provide to us. Vibhu Solanki will be joining us from the University of Nottingham. He will be speaking to us about faculty training and how to promote online acceptance in this new world. And then we have Dr. Anderson, who is joining us also from the University of Nottingham, and she is the chair of the Royal Pharmaceutical Society English Pharmacy Board. So she'll be sharing with us some licensing exam tips, as well as how to address thesis issues with our PhD and master's students. Joining us from Howard University are two colleagues. Dr. Eunice Carote is an assistant dean and associate professor and the director of their non-traditional Doctor of Pharmacy program. So with that, he has quite a bit of experience with asynchronous education, and will be sharing that along with faculty training. Also from Howard University is Dr. Lamarcus Wingate, who is an associate professor and director of assessment. He will be sharing with us some assessment results that he's already had the opportunity to perform, looking at what our students are saying. And then last but not least, as I mentioned, one of our special guest panelists is Emanuela Nezaribe, who is a final year Doctor of Pharmacy student from Kwame Nkrumah University of Science and Technology in Ghana. She is also very much involved in IPSF, and I had the pleasure of meeting her through the IPSF mentor program. So we will look forward to hearing from her. So as I mentioned, most of this webinar has been designed to align with previous questions on webinar 1. So while you may certainly add in questions in the Q&A tab on this system. The questions that we'll be addressing are those with themes related to what is the student experience, how do we provide faculty training, how do we provide application-based assessments, how do we do this in the face of limited internet, how do we promote academic integrity, how do we assure the acceptance of online learning, or the acceptance of it, and then how do we also assure it with a little bit of grace along the way. We'll be talking about thesis requirements, licensing exams, and then we'll be wrapping it up again with our students, as well as positive outcomes or rewards from this new world we live in. So with that, I will get started with our panelist discussion and ask that Ella, if you could please tell us what you've been up to in the last 6 weeks since our first webinar.
Okay, hello everyone. Thank you very much, Dr. Gleason. So quickly, I will talk about what we've been going through and what I've been up to as a student. So so far, as a student, we have been having group discussions with our preceptors via online. So we use Zoom, and we also use different platforms to also have discussions with our preceptors in the hospital. And then moving on to that, we also try to also do something useful as students. We try to get in touch with, we try to send information to every member of the public about dedicating them about coronavirus and how they can also stay safe. And so we have been trying as much as possible to stay relevant whilst waiting for the whole coronavirus to die down. So yeah, thank you very much.
Wonderful, thank you. I can see that you guys have made a lot of progress in the last several weeks. I think when you last spoke with us, you were getting reading materials and kind of doing things on your own. And then in the community, you had been, I think, on going to radio stations and such. So it's really nice to see that you all have continued on with your activities and progressed in your learning and partnering with your preceptors and faculty members. So thank you. All right, so to share with us a little bit more of student experience, Dr. Wingate, can you share what you've been hearing from your students at Howard University?
Sure. So this is from the perspective of students within the United States. And so we actually asked our students to provide any type of feedback they had with regards to the COVID-19 response. And as you can imagine, no matter how good of a response that you have as a school, as a faculty, then there's still going to be some type of problem for the students. So if our students, they expressed that they had trouble compartmentalizing their academic studies and focusing on test taking, with all this going on in the world with regards to COVID and even with their families, then it's going to be hard for them to focus quite as well as they had in the absence of COVID. And some students expressed that there was an inadequate supply of resources that simulated studious environment. And so with that, I think they're more so talking about whenever they're at home, they're not able to study quite as well as they were whenever they were in a study room in the College of Pharmacy. Even whenever they're taking a test, there may be some type of distractions within the background. And so that is something that is acknowledged that could be a little bit different whenever they're here in the COVID-19 environment. However, the students did express that the response to COVID-19 has been extremely professional on behalf of the Howard University College of Pharmacy. The staff and the college really focused safety. And so we did the best that we could in order to be able to transition the students to some type of online environment where they could be out of harm's way in terms of the virus spreading. And the students also expressed that they know that we're working together. The students, the faculty, and the staff all work together to be able to help us to get through this. Even though it's a little bit different, we all did work together to make this the best experience that we could in lieu of the circumstances. Thank you.
Wonderful. Thank you so much. It's so nice to get these data in real time. So thank you for the work you've done to capture this. And it sounds like the students at Howard University are very similar to what we've been seeing in the literature quite a bit that, you know, this working from home or learning from home does have its distractions. But as you mentioned, they're very appreciative of all the work that you're doing and are being very professional in the face of all of it. So very nice to see, and thank you again for your great work there. Wow. I'm sorry, my screen went black there for a second. All right, so also joining us from Howard University is Dr. Eunice Kurote, who, as I mentioned, is in charge of their mid-career distance program there. And so he has quite a bit of experience with asynchronous learning. And so he's going to remind us about how we train in this environment and the differences between remote and online education. So Dr. Kurote, could you take it away, please?
Absolutely. Greetings. Yes, there is a fine difference between the ERT, emergency remote teaching learning, and your traditional online learning. However, they both have one thing in common. Just to piggyback on the previous question and answer, is that with online learning environment, there is that sense of isolation. Of course, for someone who is signed up for an online program, they understand that. But for students or programs that had to go on a quick transition to be online, students were not ready. Online environment, it is not for everyone. Therefore, there are some challenges. So I guess the take-home message is that even for student and faculty, that even though faculty are usually more comfortable teaching online by second or third repetition of their courses, it will be impossible for every faculty or student become an expert in how to navigate online environment, and also learning in this current situation in which lead time ranges from maybe a day or two to prepare to maybe to a few weeks. So I'll just leave it at that. Thank you.
All right, okay. Dr. Kurote, did you want to share some more about things that we should be considering, our institutions should be considering, excuse me?
Oh, absolutely. The ERT-related questions that one may want to consider, there's a long list of that. I'm just going to briefly give you a conclusion, because this was somewhat covered in our previous webinar, and there is the evaluation for ERT should be more focused on the context, input and process element than the product, meaning the learning, because the time to prepare for that is traditionally is short, quick, and we experienced that for my university on March 13 when we were on spring break. Note that we are not really advocating for no evaluation of whether or not learning occurred or that what extent it occurred. We're looking at whether or not the information was received by a student. Also, it's also we recommend that when you look at the literature, the recommendation is that there should be a standard end of the semester teaching evaluation, not to be counted against faculty member engaged in ERT because of a quick transition to a ERT type of environment. If an institution's policy mandates, and most schools here in US do, that those evaluations be administered, I think we need to consider amending the policy or make sure that the results are clearly qualified with the circumstances of the term or the semester, knowing that this was a kind of response to an emergency situation. And I'll leave it at that. Thank you.
Yeah, thank you so much. I really appreciate the point that you're making about putting this all into context as it comes time to assess it all, because what we're going through now is not the same as our usual methods. So as we evaluate not only our teaching methods, but also the feedback we're receiving, to keep that in mind. So with that, how do we prepare our faculty for this new world, Dr. Kurote?
Oh, absolutely. Preparing and training faculty for an emergency remote access versus online, there are some fine differences. We went through this slide sometime in our first webinar, and there has to be a need assessment for faculty based on whether they have had this experience before, whether they have had any formal training, and also whether they are using LMS learning management system and they have had a formal training on that. It would be great if we have a number of faculty. It would be ideal to have majority of our faculty to have to hold some type of certification in those trainings so they are familiar with the use of the system, because most often in this time where we are dealing with most millennial population, our students have no problem using the technology. But that is not true when it comes to faculty. Depending on the faculty experience, their seniority, there is a variety of experiences that is shared by faculty. So you need to do the need assessment. Then once you have that, it's really providing and supporting necessary training for the transition to remote environment. Also, if in case of asynchronous, which is much more organized and planned type of transition, we need to provide and support training for the online programs. And that normally takes a bit longer. The time period for a course to go from a traditional on-campus to a online, fully online offering, it could take from 3 to 6, 9 months, really depending on the volume of the courses and also the familiarity of the staff and faculty, and of course, the available technology that is very institutional based. And of course, we need to provide other additional training on an as needed basis so that the faculty is up and up on their game. And also communication, even though transitioning from any teaching environment to a different environment, it seems like a technical transition, but it really is all about communication. What type of messaging the institution is sending to students, the faculty, staff, and any other stakeholder out there. So that messaging is very important. It has to be concise, clear, to the point, expectation, all of it have to be looked at and reviewed.
All right, thank you so much. I really appreciate what you're saying, is that what you said early on, that the faculty sometimes are not quite as adept as our students are. And so even some of the most basic things like learning how to work our learning management system, whether it's Microsoft Teams, Canvas, Moodle, what have you, sometimes that is the first step we need to take. Or in the case of, as we experienced this morning, how to work Zoom. I know we've dealt with that at our institution. So thank you for providing all of those detailed thoughts and considerations, Dr. Crody. I think that's
My
some
pleasure.
great information for our colleagues. So moving on, if Vibhu Solanke from the University of Nottingham can share with us some easy wins. Sometimes it's the simplest things that can make a big difference. So Vibhu, would you want to tell us about that?
Good afternoon, everyone from the UK. That was a very comprehensive guide from Dr. Korode. So let me just share with you some quick and easy wins. I think the key thing is to once again, as a group, really review your learning outcomes. Think about some of the things that built your program in the first place. So review them and adapt those learning activities based on the resources that you have. For me, it's keep it simple. Clarity and context always wins for me. So within your teams, make sure that you keep the message really, really simple as to what you're trying to achieve, and therefore that clarity and the context will eke out at the right times. In many cases, it's about workforce management. It's about introducing some of those lean efficiency systems within your group. So have a think about what your workforce is doing, what the rest of the academic team are involved in, and maybe starting to think about how to streamline some of those key tasks towards building an online platform ready for your recruits for next year. I think one of the big things to keep in mind with yourselves is often enough to create is to innovate, but sometimes we just need to just take a step back and curate what's already out there. So that's just slowing it a little bit down, learn from those that have done it before. So it's very worthwhile looking outside of pharmacy, certainly maybe potentially looking outside of healthcare, because healthcare is very much vocational as a consequence, and our learning activity has been built around that. So what are other subjects doing within your faculties, within your institutions, and how they introduce the digitization of some of the activities that they have introduced into their modules and learning programs. And really, online communication skills, consultation skills, that's something to really think about with regards to your faculty as well as your students. Here's an opportunity to introduce the future changes into that are going to occur in practice into your teaching. So, for example, online consultations, etc., and introducing that as a quick win into your structure. And finally, really, just you are already good at what you do. Just change how you do it. Reuse, reframe what you already have. And in many cases, stick to what you're great at doing. Try not to constantly reinvent the wheel and recreate things.
Wonderful. Thank you so much. I really like the basically keep it simple, and using the resources you have, whether those are technology tools that you have, or like you said, what you're good at, and really just grow from there. So thank you for sharing those easy wins for us. And the student involvement, tell us about that, of how you've used them to help out.
Absolutely. So certainly at this stage, a lot of people are either creating or co-creating online programs with existing programs, or creating a fully online program. I think it's really important to center around the why are you doing what you're doing, and that is obviously the student. And I think most of the time you'll go back towards your student. So build the online program around your student. Once again, it's probably really important to know them. What do they need? What do they have? What do they want? What Eunice was talking about in terms of, do they have the infrastructure, the accessibility? What have they got available to them? And help them to help themselves by getting them involved in creating a course for today and a course for tomorrow. Involve the students in creating a community, which obviously creates further collaboration, and then as a consequence you can do a lot more things with regards to your online platform. If you're interested in knowing, please contact me separately. I worked with another academic and a group of students over the summer to create what we call Taming Gaming, and we created a virtual pharmacy environment for international students, and that was done with the students. They came up with the ideas, and we provided them a platform to do that, and that is using sort of computer gaming technology and virtual reality. Thank you.
Wonderful. Thank you so much. It's great to see how we can use our students to help us. So switching gears here, let's talk a little bit about how we provide application-based assessments, whether that's OSCEs or formative types of assessments that are application-based. So we have quite a few experts here and quite a lot to say about it. So Dr. Mack, can you please start us off with this topic?
Thanks, Sean. So essentially, OSCEs are aimed at assessing competence in a wide range of skills. So they're often hands-on and mimic real practice. So these assessments require heavy resourcing even before COVID-19 days that we probably don't really remember much anymore. But social distancing makes it quite complex, especially if you have a really large number of students. if you require them to come back to face-to-face examinations, when you are following social distancing guidelines, maybe reconsider some of your exam cases. And if multiple people are required within a small space, you might want to reconsider using those exams or modifying them. Maybe also consider reviewing the number of OSCE stations required. I know some universities have maybe only a couple of stations and some have from 16 to 20 station OSCEs. I would suggest maybe retaining the stations that can only be assessed synchronously. So these may be stations that assess hands-on competencies such as device counseling. So once you decide which stations you want to keep that needs to be assessed synchronously, you can consider then moving some of these assessments to an online OSCE, which are synchronous where possible. For example, counseling assessments that can be done online via video conferencing tools such as Zoom. And Sarah will talk a little bit more about online OSCEs in the later part of the presentation. You can also choose to modify some stations to video recording assessments. And this can address equity issues, especially those who aren't able to undertake synchronous sessions due to poor internet access. And also when you're reviewing and retaining OSCE stations, you might want to convert the non-active stations, so calculations or written assessments in those stations, to a different form that doesn't require you to have that face-to-face or synchronous type of assessment. Some competency assessments can be assessed at students' experiential placement sites, and Rebecca will talk to you a little bit more about it in terms of how you can do that. And OSCEs in itself can be so time consuming, and they're commonly scheduled with very tight turnarounds. So you'll need to also consider and factor in time into transitions between students, because if you're doing it face-to-face, you need time for cleaning. You need to clean the space after each student. You need to clean devices or props if they're using them. So make sure that you also include that into your time when you're doing face-to-face OSCEs. In the next slide, I've provided some information if you choose to modify OSCE stations to video recording assessments. The first thing you need to do is really provide clear instructions to students. And I've learned this a hard way. I've changed it to a video recording. And if you don't give clear instructions, you get a wide variety of quality of recordings. So firstly, what options are there to record? Never assume every student has a smartphone. As much as we think, you know, it's a new era and everyone has a smartphone, some students do not own a smartphone. So provide a variety of options. So whether they can use video conferencing tools, a webcam, a laptop, whatever tools they can use to record. Also provide step-by-step instructions on how to record their role play. It's as simple as telling them when they use their smartphone to film it in landscape mode. Just because when you're going to assess them later on, it's easier for viewing and you're not tilting your head, you know, in 90 degrees trying to watch the videos. Where and how to submit the recording, we get them to submit on our learning management system, which is Moodle that we use. However, it does have its limitation on file sizes. So you do also need to tell them how to compress files. You can also provide apps that are freely available that help reduce file size as well. Never assume text instruction is sufficient. You can give them a whole lot of text, but sometimes they still want the opportunity to ask you questions, and it will be important to have maybe some live Q&A sessions with them, maybe something like a Zoom webinar like we're doing now, for them to be able to ask questions and for you to answer them live. When you have large number of students, it means providing individual feedback may not be feasible. So we can record a feedback video, and we provide this using a structured feedback model that we use at Monash. We use the keep, start, stop model. Essentially, it's what the students should keep doing, which are areas they're doing really well, what they should start doing, so things that they should improve on, and what they should stop doing, things they shouldn't really be repeating anymore. So in the next slide, I've given an example about one particular station that you can convert in very different ways. Now, firstly, demonstrating how to use an inhaler is a very different skill compared to observing how a patient uses an inhaler. So here I've given an example of an inhaler device counseling. You can modify some of your learning outcomes depending on what is feasible for your university. If you want a student to educate you on an inhaler technique, you could get them to do it as a video recording. If you want them to identify different incorrect inhaler technique, you can pre-record videos with different errors and put it in as a quiz, and this could be asynchronous. If you want them to do a live online OSCE via Zoom, you can get them to identify and correct inhaler technique in a manner where you're assessing the student's ability to observe and correcting it in an appropriate manner. Now, why I suggest to do it as an online OSCE is because there are a lot of our students who are now staying internationally in different countries. They probably don't have inhalers in their house unless they probably own one. In this instance, you can get the patients who are probably on campus with you to use the inhaler and actually use it as part of them, the students assessing the patient using the technique rather than the student demonstrating it using the inhaler. So these are just some various methods you can modify some of these assessments. And I'm sure Sarah and Rebecca will follow up with a couple of different examples, but variety may benefit the student. So you can have some live OSCE, some recorded, and different variations. So hopefully you found some of these useful for you to use.
Thank you so much. I saw in the chat someone had said that this is very practical information, and I wholeheartedly agree with that. A lot of things that you've thought about there. So thank you again. So Dr. Schooler, can you tell us how you've been doing OSCEs with a large number of students?
Sure, I'd love to. And I also wanted to touch back to what Vivian said. We also did kind of an OSCE talking about inhaler counseling, and I really love that she talked about having videos where they assess what's going wrong in the technique. And we actually did it as well, where we had a form with students that the student was able to share their screen with the patient to show the inhaler and all the different steps on how to go through it. So there's a couple different ways to go about that. But for this example, for our OSCE, we did taking a medication history, and we did this live through Zoom. We've also done taking a medical history as well. And so just to also try to be practical about it, you do a lot of scheduling. The scheduling takes up a ton of time, unfortunately, but we're getting better and better at it. But you really want to make sure that when you build that schedule, that you build in open spots for tech issues. And so we had quite a few students that, not quite a few, we had maybe 4 out of 108 that had some issues with tech. But we said, no problem, we're going to schedule you for later on in the session so that they had plenty of time to work through those tech issues. So that's really helpful too. We also use Zoom breakout rooms. For us, we use standardized patients. But within that breakout room, then we had the student, we had the standardized patient, we had the assessor, and then actually you could have proctors that kind of float in and out of those rooms. So I was actually a proctor, so I could see how sessions were going, jump in and answer questions for the faculty after, anything like that. For academic integrity, we had students show their workspace, so actually using their computer and using their video on their computer, show their environment, their space, make sure that we didn't have any kind of papers or rubrics or anything in front of them. We also did allow them a scratch piece of paper, and so they had to show the front and back of that scratch piece of paper. And then, like Vivian was talking about, we had 2 different assessments, or one, we had students each record, and then they posted that to Canvas. We also had another assessment where we had faculty record all of their students, and then they put those into a shared folder online. And I will say one kind of tidbit that we learned is that Chromebooks do not have functionality to record in Zoom. So we learned that the hard way, but we were just able to record the session for the students. As far as the part 2 of our OSCE, we did drug information and calculations, and we were able to do that on an online proctored environment. And that was all open response. We also did an errors and omissions, where we would show different prescriptions, and students in an essay response would have to talk about all of the issues with this prescription and if they would choose to fill it or not, and what their response would be. And that was on an online proctored environment. So on the next slide, we have just an example that you all are welcome to pull from. We don't need to be recreating the wheel here. But this was an example of a schedule that we put together for the OSCE, and just some tips in there. You'll see different breakout rooms. And we broke them, we had such a large group, we broke them into group A and group B. And so group A would have a specific Zoom link and meeting ID, and then group B would have a different Zoom link and meeting ID. But with this schedule, we were able to get through a taking a medical and taking a medication history exam. We were able to get through 108 students in about 2 hours and 20 minutes. And then on the next slide, so this is just kind of an example, this figure here. So when learners enter the Zoom, they automatically enter into a waiting room. And the nice thing with the waiting room is they cannot talk to any other student. It's basically, they think it's just them in the waiting room, but you can have lots of students at one time in the waiting room. Actually, you could have all students in the waiting room, kind of using it as an area if you're worried about academic integrity, so that you're kind of watching them for the whole session. But you have students come into the waiting room, and then the co-host or the host can then allow them to come into the lobby. And you can be in the lobby. So there was a session where I was in the lobby, and I actually went back through instructions with the students, made sure that everybody was able to record, made sure that their microphone was working appropriately, got out some of the jitters, joked with them a little bit, and then we were able to start moving them into their breakout rooms. And so over here on the right side of the slide, we actually had students pull up a Google timer so that they could see their time. They had 10 minutes for this exam. They could see their time, and we could see their time on the recording as well. So they didn't go over time, but they could also kind of monitor. And then we have up here, we have the student in the top right corner. We had me as the proctor sitting in, listening and taking a screenshot. We had the standardized patient, so they were communicating, and then we had the faculty advisor that was taking care of sort of the content piece of the rubric. So that's kind of how we went about the OSCEs. Another really helpful thing that we learned is that at the same time we were running Zoom, we also did run a Microsoft Teams chat where we had all of the faculty, everybody that was involved with the Zoom except for the students on that chat. So if there were any issues that arose, they could just type in the chat, and we could all say, okay, I'm in this room, I'll hop in this room, I'll help out. And that was hugely helpful as far as allowing for good communication within Zoom, as well, having that Microsoft Teams. Thank you.
All right, thank you so much. Having been a part of that, I can tell you it went very smoothly. So Rebecca, could you please share with us some of your experience with converting activities to placement settings?
Yes, so it would be my pleasure. So hello everyone, it's nice to be here. It's nighttime in Sydney. At Sydney Uni, we've actually been looking at particular competencies and things that we would really, really love to be doing face to face, but you know, at certain times it hasn't been possible at all. And it's particularly for our students who are still overseas and can't even come to uni for social distancing things. So, you know, it could be about device technique, it could be counseling or medicines, dispensing skills, it could be compounding, so making extemporaneous products, taking histories, and first aid. And the things that are in black, you've actually just heard Vivian and the speaker before, sorry. I've just gone blank. I went blank. Sarah, sorry, talk about how some of those things can be done online, and we've also done those in online simulations as well. But for some of them, the ones in red, it's very difficult to do them online, or you can adapt them like Viv talked about. But if you really want the student to play with devices and touch them, you might need to do some things in a pharmacy setting. If they can't come on campus, maybe they can go to a pharmacy and ask a preceptor to assess these skills. If we go to the next slide. So, for example, we have already talked about inhaler or other devices, but you could get the preceptor to do that. Perhaps in their workplace, or perhaps in a placement. Similarly, the extemporaneous products, if you've got students that need to make a cream but they can't physically come into the lab because they're living interstate or in a different country and there's travel restrictions, then maybe again we can ask. So we've been thinking about asking our alumni. We have alumni all around the world working in pharmacies. So we're thinking of trying to find preceptors for these students that are overseas in order to complete these skills. But thank you, just a little tip from us.
Thank you so much. Yeah, it's important for us to think outside the box and think of our resources. And sometimes those resources are our colleagues in other settings. So thank you so much for that, Dr. Moles. So next up is kind of changing gears, but still focusing on application-based activities. One of the most common questions that we received on the prior webinar was, how do we do laboratory-based classes? And you know, admittedly, this is probably this is a big challenge for anyone having to face this. So we have a few ideas here. One of them is the lab in a box idea. And Dr. Altieri, I'm not sure if you're on the line. Did you want to tell us a little bit about how Unitwin did this?
So yeah, I haven't thought about lab in a box being used for laboratories when you're not at the school. But at any rate, lab in a box came to me, this was a number of years ago, and it sort of sat on my desk for a long time until I got involved in the Unitwin program. And then one of the schools in that program needed laboratory equipment and supplies that you know, they couldn't afford for all of their students. So we managed to arrange for a shipment of these lab in a box kits to be sent to them. Now, you can customize these boxes to include whatever it is you need to have. So this was designed specifically for a lab in a pharmacy school. You could do the same thing for chemistry or biology or a variety of other things. There are a number of companies that do this now. And one might think of how, and I'm just thinking off the top of my head right now, because I think I suppose it's a possibility that a student could take one of these boxes home and you could have students doing laboratory experiments, being careful what your chemicals are that you're using that are not too toxic to people around them. And you can probably do demos by the faculty member on what those experiments should be, and the student could be doing those things at home. And it's a kit. You just take it with you. It can go anywhere, and I think it's a real possibility for doing some of these basic lab activities that you need, and can be done in the home environment.
All right, thank you so much.
So it's a brand new use for the lab in the box. I think it's a good idea. I suppose you could get these made specifically for doing compounding. And I think you can probably do these at home. I mean, you know, you do it in your kitchen. You know, well, I mean, cooking and chemistry are very closely related.
That's right.
Yep.
That's why so many of us at CU are bakers.
Right.
Anyway, thank you for sharing that. When I Googled lab in a box, there were tons of websites that came up, and they were actually, a lot of them were centered on children, where they were sending them to the home. So they were doing laboratory experiments in the home. Granted, probably not dealing with the same chemicals we may in pharmacy, but yes, I think they can definitely be created to meet our needs. I'm going to, Ralph, please stay on the line if maybe you can add anything to this. So as you go into, move this away. As we prepare to go back on campus, we do need to think about social distancing. And I know our university has some guidelines that our teams need to go through, our individuals need to go through before we can enter back on campus. Dr. Altieri, I still was not able to get access. So can you just maybe give us one or two bullet points of what that training prepared you for? Just thinking about things? Was that what it was? Thinking about rules.
Repeat the question, Sean.
The SkillSoft training that the university is having faculty members do before they go back.
Yeah, I can share this with everybody. I got permission to do that, and I can give you the exact training program itself. It just happens to be put on the system that we use at our university, but you could download this onto whatever systems you may have. It's a particular university created login for us. But at any rate, it is a system where, so we're trying to get a restart on our campus because it's been closed for 11 weeks now. And it goes through a variety of things that you need to be aware of. Most of us are aware of these things, but it's a good refresher of what you need to do, you know, for your social distancing, wearing a mask, and the various requirements that are needed to return to campus, and what you have to do once you're on campus. So I could easily provide that entire training program. So Sean, maybe I could send it to you and you can get it out to everybody.
Certainly, that sounds
And
like
I mean,
a great
I
idea.
suppose we should just have it available through FIP in general.
Yeah.
Yeah.
It would be very helpful.
Mm-hmm.
All right, thank you for sharing that. So in the interest of time, I'm just going to quickly talk about the last bullet point, which are simulated laboratory experiments. So you have the website here for, it's really what appears to be an amazing site from Purdue University here in the US, where it is actually a clean room simulation. It goes through how to clean the area, how to deal with different types of chemicals, going from easy chemicals all the way up to creating oncology type products. It really is an amazing product. It does have a fee associated with it, but this is one way that you could use simulated online activities to meet some laboratory needs. Naturally, this is going to take a little bit more bandwidth. Another site that has a variety of laboratory experiments, laboratory simulations, is labster.com. And so if you wanted to go to that website, you can see all that they have available. So there are a number of commercial for fee sites available, but with that, I am going to pass on the slide back to Dr. Mack, who can tell us about a free, no charge simulation activity at Monash University.
Thanks, Sean. So it's My Dispense. If you haven't heard of My Dispense, it's a simulation, a virtual pharmacy simulation developed at Monash University here in Melbourne, Australia. So My Dispense enables students to practice the skills of a professional pharmacist from novice to highly advanced in a safe online environment, and you can use it anytime, anywhere. And all that's required is an internet connection. So you don't need to download any software whatsoever. We've created My Dispense about 9 to 10 years ago now, and that's why it was called My Dispense to start off with. It was solely focused on dispensing, but it's come a long way since then. Now it consists of not just a community pharmacy simulation, it also has a hospital simulation, which I think a lot of people are quite excited about. That's quite new. We've just incorporated that this year. And students can undertake scenarios where patients can present with a prescription or self-care requirements, but they can also be challenged with validation tasks requiring them to check the work of virtual colleagues for accuracy, legality, and medicine safety. I've seen it around the world. People have used it to teach ethics, to teach cold storage, cold chain requirements, scheduling, a lot of various activities that a lot of people have done. Over the last few weeks, the platform has been rolled out across pharmacy schools in the United States, Jamaica, even in Australia, Kuwait, because of coronavirus, taking the total number of schools using the platform to over 120 schools now, with some 18,000 students worldwide using it. So the simulation now not only allows pharmacy students to hone their professional abilities during a global pandemic, it does enhance the learning experience and ensure students are fully prepared for work in a changing world. It is a simulation that is developed at Monash, but is freely shared with schools around the world. And I know I've seen a couple of questions in the Q&A box about how you can obtain it. You can visit our website at info.mydispense.monash.edu, or just shoot me an email and I'll pass you on to the relevant people. Some universities in the US have used it as part of simulation for EPIs or IPIs, I think placement activities that you talked about. So you could potentially use that for that as well.
Wonderful. Thank you so much. I saw in my email this morning that I believe I have access as of today, and looking forward to learning more about it tomorrow. And we will be using it for our IPI placements this summer. So thank you. Looking forward to that. All right, Ella, I'm wondering if you can come back to us and share a little bit of what your school is doing to help you all out in the face of limited internet. I know you talked about cellular access. Let's see. Oh, there you are.
All right. Okay, so with issue of the internet problems which we have, usually for our school, what they did was that they made sure that everyone had access to the internet. So the school provided, already we have SIM cards which everyone has access to once you come into the school. So they had to increase the amount of data that is being given to each student every year, and that's so that at least no student would have that as an excuse for not attending any online classes that's been scheduled by anybody. Okay, then then for and then I think for various assignments, for the assignments that have been given to us, the online assignments, they made sure that they gave a reasonable amount of time, like making it very flexible, so that like with the assignments they give deadline, at least long deadlines for everyone to be able to meet. So in that case, there won't be any excuses with limited internet. So that is one way they have tried to actually make sure that everybody is on board with the new development. Thank you.
Wonderful, thank you. Some excellent, again, practical information, including being flexible in the case of limited internet. So sticking on this theme of limited internet, one of the best ways to provide this education is asynchronously, because doing this by Zoom takes up quite a bit of bandwidth. So Dr. Kuroda, can you provide us with some quick guidelines on how we can do this asynchronously?
Oh, absolutely. The online teaching, the asynchronous, is pretty much what is needed to address post-COVID-19 era of teaching. So it is good to have this type of vehicles. But one has to remember the online programs are planned from beginning and designed for online audience. So there's plenty of time for planning. There are also advantages as far as if you are providing the course contents in the form of live or pre-recorded captured lecture. That way there is an option for if the lecture is not recorded and quality is not your standards, then you can re-record that as faculty to do that. The design process is a lengthy one. I'm not going to go through each one of these processes. It was kind of discussed, I guess, last time. But basically, you want to see what type of online program they have, whether it is a fully online, whether it is 50% online, or is a web-based, face-to-face type of program. For our program, for example, non-traditional, been in since the inception in 2003, it has been one of the features was advertised as self-paced, and most working professionals prefer that because they have other obligations. And also it is the ratio for your student-faculty ratio, because classroom size resources are really not the limiting factor as compared to the on-campus classes. Your ratio can vary from 1 to 35 to maybe 1 to 1,000, whereas in a regular traditional on-campus environment, the ideal ratio is the lower the ratio, the better, 1 to 8, 1 to 10. And also the role of the online assessment, one can also build that type of feature into the program. What's so interesting is that there is also the instructor role that has to be well defined, whether it is just a listen and read by a student or a complete problem or answer type of questions. There is also the delivery method, whether it is asynchronous only or synchronous, or maybe a combination of both. Source of feedback can be also provided in this situation. And I had said earlier, the time needs for the online to be ready and to be delivered, it range from 6 to 9 months. And of course, as I said earlier, it takes a few practice for faculty to be able to deliver a high quality and course-rich content. I have on the next slide, we can actually see what I had just described in this slide here, the quality of instruction. For example, for us, the quality is important because students who are on the receiving end of this lecture that is pre-captured, that is their only source, in addition to maybe some notes from the faculty, perhaps some PowerPoint, some clips for parts that they need to visually see what's happening, is that we have that option that we can always, if the quality is not good, then we can always have the faculty re-record the lecture in advance and we can post that. And that does happen sometimes, even though we have assigned individual who will pretty much sit through each lecture, and you can appreciate how many lectures there are for each module. So, like for example, cardiovascular system, it's a 12, 15 different topic, each one with some subtopics also included. So the source of feedback, like I said, it can be set up so that it's automatic, or it could be teacher-student feedback and the peers feedback. On the next slide, what I'd like to talk about is actually some of the activities that I like to go over, and these, I should say this, that there are a variety of benefits associated with asynchronous learning. For instance, not only can it offer learners the ability to access information and coursework when it's most convenient for them, but it also allows them to learn at their own pace and fully acquire the knowledge that is being provided before moving forward. That a student can go back to the lecture more than once and re-listen to the lecture or take notes. The faculty can create a concise, logically organized, a visual presentation. It's not difficult. What we do actually, as my colleague said earlier, what we do that works for on-campus, in-class environment, we can use the technology that is available to capture that and present and forward that to the online learner. Class demonstration can be taped and clip can be uploaded for a student to see. A group work can present both instructor and student with a different set of challenges. To overcome those challenges, faculty can provide a student with tools of online collaboration. Like I said, for the fully online program, one of the issues that students often talk about is a sense of isolation. If you are a type of person who learns by group, working with group and sharing with friends, or if your learning style is different, this may provide you with a challenge, but there are easy ways to overcome that. Student presentation, both formal and informal presentation, where students prepare and present a speech and then respond to questions or critics, are invaluable learning experiences where students can learn from one another. We have in our non-traditional program, we have an eye care lab where a group of 4 or 5 students meet with one clinical faculty preceptor online once a week over 90 to 120 minutes, and they actually discuss real cases that are the preceptor and the faculty brings to the discussion. Speaking of discussion, student to student or student to instructor dialogue can occur outside the standard discussion board within the LMS system. If most schools, I'm assuming, have learning management system, and those learning management systems do have a lot of features where you can use to deliver this type of course content. In-class practice activities, a faculty can perhaps add a self-check question to videos or lecture material using interactive presentation tools, and that goes a long way for in student having a positive learning experience. So I guess in conclusion, what I like to add is asynchronous system gives students the opportunity to learn from anywhere at any time. While this can be perhaps scary for some, designing or teaching for faculty for designing and teaching their online courses, but one has to remember that with a few modification to faculty's current course, as my colleague said earlier, what we do good, we can take that and deliver that online. This material can be offered online and can be a rewarding experience both for the provider of the course content, faculty, and the students. This includes, engagement, communication, and community all look different in online type of classroom. It's not the same, but the basic message is the same. That is, there is a subject matter we are having the student engage, and there is a learning that is taking place. There is a teaching that is taking place. So some tools are available that are discussed in detail in my slide that can be used to ease that type of apprehension as far as, what am I going to do? But, I need to say this at the end of my talk this morning. That is, I actually was pleasantly surprised to find out how quick, how fast our faculty, and I'm sure that's true for most schools, we had spring break 5 days to switch from our traditional on-class to our online transition, and it went well. And I think that the lesson learned from that will definitely affect and change how we deliver education going forward post-COVID-19. I thank you.
All right, wonderful. Thank you so much for sharing that wealth of experience you have there in providing asynchronous education. I'm just going to quickly share just some examples of what Dr. Kuroda has shared, of what we've been doing here at the University of Colorado. One of the most important concerns that I think we all have when providing online education is it still engaging for the students? So this is just an example of a lesson that I have provided in our online program, our mid-career distance-based program. And I teach tuberculosis. For those of you who don't know me, tuberculosis is one of my favorite things to speak about. So for me to give up teaching of epidemiology and pathophysiology was quite a stretch, but I did it. And what I did is I had the students do the teaching for me. So I broke my students up into groups of 3 or 4, and I told them each group was going to teach the others about epidemiology or pathophysiology, and they had an opportunity to work on it together in their choice of settings, whether that was threaded discussions or wiki pages, and so those two take less bandwidth, or they could do it by teleconferencing if they wanted. And what they were assigned to do is provide a 5 to 10 minute PowerPoint presentation. I provided them the learning objectives. I gave them some resources, but then I let them rely on their self-directed learning experience and come up with others. And then they posted it in a discussion session, getting back to what Dr. Kuroda mentioned. They gave each other feedback, and when it was final, they also provided the exam questions for me, which I did indeed use. And then I picked up the rest of the lesson on the pharmacotherapy. But you can see here from a student posting, they enjoyed doing it. It was engaging for them. They worked together, and my goodness, Dr. Altieri and I were talking about this yesterday. They did a better job than I probably would have done. So it kept them engaged in the online environment. Another way that we've been working on doing online education is using some of the tools that we have, and we've heard people talk about that already. So we wanted to do some adaptive learning, but we didn't have any fancy systems. So my colleagues, Dr. Reynolds and Dr. Ryan, put together essentially an adaptive learning session. They've done it for a number of different cases using Qualtrics, which is our survey method. You could do the same using something like SurveyMonkey, and basically they have a variety of questions, and depending on how the student answers, they get feedback, and it also can take them down a different pathway. So it is adaptive, but again, it is using resources that we already had, being just a standard survey tool. This is a little bit more fancy, but we, have some concern about providing, audio recorded PowerPoints. Is that going to be engaging or not? And there are a lot of amazing platforms out there. One that we've been working quite a bit on, or I should say my colleague Dr. Ryan has been working quite a bit on, is on TechSmith Relay. So it's an audio accompanied PowerPoint. It's engaging in that it has her recording. You can see her, so the student feels like she's right there with them. But it also has the opportunity for students to provide questions over here on the right. And when a student provides that question, Dr. Ryan received an email right away saying that. So she could log in right then if she had the ability to do so and answer it. And then you can see down here, SG, if I wanted to, as another student, I could comment on that too. So it can be real engaging asynchronously, but also pretty much in real time. She has also provided embedded questions in there, so you can do some formative learning. And you can also take this offline if internet bandwidth is an issue. When you do go offline, then you lose some of those discussion features, but some pretty amazing things that you can do in the asynchronous environment. So with that, one of our other concerns is how do we promote academic integrity? So Dr. Moles, can you share with us this fun slide?
Sure. So I totally agree. The questions we've been asking ourselves are, will our students be engaged? But the other one we've really been asking ourselves is, will they cheat? So I think the way we have to get around that is we actually have to think like a naughty student. So in order to work out how they might cheat, we have to think about, well, if we were a naughty student, how would we cheat? So some of the things that we've been thinking about is that a student might ask, oh, I could get someone else to pretend to be me. If it's all online, someone else can log in, it won't matter. So we've been asking our students to have their camera on so that we can see them, and to also show ID. We've had, not every student wants to do that. There have been privacy issues, but we ask when they're speaking, they turn their camera on just like we are tonight. But so another question, like, could I sign into my online class, but I could just sit there sort of, still have my camera on, but really not being engaged in that? Well, obviously that can happen in a face-to-face class as well. But you've got to obviously keep asking people questions and asking different student questions to try and keep them engaged, and to use those tips that Sean had spoken about as well. We've also thought about, well, if we do online exams, there might be students saying, oh, wow, I can look anything up during the exam. Like, I can have my phone next to me, I could have another computer screen, I could contact my friends, and maybe they'll never know. So you might want to consider some of the proctoring tools, which actually take over the student's camera, and can, use artificial intelligence. You might actually want to even rethink your exam. Why don't you think about, well, what if it is open book and they can look things up on the internet? And if we ask more of the what questions and the why questions, perhaps we can mitigate or limit the amount that you can look up, because they're much more difficult to explain. So students have got to do more explaining. It's not something that's just found straight out of a textbook, perhaps. Obviously, as well, if it's a written exam and it has been open book, you might then want it to use text matching software. So we use Turnitin as one of ours at Sydney. we've been running the OSCEs as well online, and we were very worried about the scheduling, and if students could work out our schedule, they'd be able to go, oh well, that's great, my friend Sarah, her exam's at 9 o'clock, I'm not on until 10. As soon as she finishes, I'll ring her up and I'll find everything out that's in the exam, and I'll do really well. So we're randomizing the cases per student, so we're having multiple number of cases, mixing them up, so it's really hard for them to work out the timetable. We also only email the student their link into their OSCE Zoom room 5 minutes before they're to go in, so they know that they'll get an email between time A and time B, which might be an hour's time slot, but we'll only email them when it's their turn 5 minutes before they go in. Just a couple of things. So think like a naughty student, and maybe you'll get around some of the academic integrity issues. Thanks.
Wonderful. Thank you. Thank you for sharing that experience and being able to do that. I think we all can probably do that in our background, thinking like a naughty student. So some good practical tips again there. So Dr. Schooler, I know you have some thoughts, and I think we all do, on is proctoring really always needed? So what are some ways we can build around that?
Yeah, so I think that I'll be piggybacking quite a bit off of what Beck was saying as well, but I really think that, and Vivi was talking about some of our easy wins, and I think that this kind of COVID situation has really put us into the place of really re-looking at our assessments, and is proctoring always needed? And so I think that focusing more on skill-based assessments, the communication assessments, calculations, drug information, gathering information from patients, all of these things that you can't really look up, making sure that when you're looking at your exams, you're really focusing more on assessing your students and their ability to critically think. So having more difficult cases with open responses, whether they're doing an assessment and plan, whether they're working through solving issues, making sure that those cases are less straightforward, that they're kind of in the gray area, so there can really be multiple different answers for those cases. I think sort of limiting the number of proctored assessments, and I think that there is there's obviously a huge responsibility on all of us as faculty to make sure that we're adequately preparing students and teaching them. That's kind of why we got into this. But I also think that there's a big push in this environment to ensure that the responsibility of learning the material falls on the students. And that may be, if the student is really thinking, okay, I need to make sure that I'm prepared before I go on to rotations or before I, do my board exams. And with that, I'm really an advocate for these step exam OSCE type experiences, and those being in a proctored environment, so that there is a formative assessment that is proctored sort of at the end of this, that they can really make sure that the responsibility in making sure that they know that material is on them. And so it really kind of helps with cheating. Also, I'd really like to say it is not a good idea to curve exams. I think that anytime that you're putting students up against one another, where my grade may depend on Vivian's grade based off of curving, I think it's really important that we remove that, because what you'll find is that you have students that are cheating that wouldn't normally cheat just because other students are cheating, and that's what the curve is based off of, and they really need to cheat in order then to get an adequate grade in the course. So it's really important the responsibility is on the individual learners, and that we, like Beck was saying, that we focus more on changing the what questions to the why questions. Thank you.
Wonderful. Thank you so much. There's some useful information there about curving. It sounds kind of like the sports world there too. So some analogies there. So Dr. Malone, can you share us your thoughts on proctoring and if it's needed?
I can. Thanks, Dr. Gleason. Yeah, following on from what Beck and Sarah said, look, even if proctoring is available, it is really important to normalise the conversation of integrity, I think, to assist in creating the culture where students will be less inclined to cheat. And this can include aspects like talking with students early and often about integrity, and giving examples of academic integrity breaches and discussing it with students. And novice learners in particular may not understand university rules around plagiarism and collusion, for example. Getting student leaders involved in promoting integrity is important too. Getting all students in the mindset of being a pharmacist in training, including reminding students of the oath of a pharmacist that talks about holding oneself to the highest principles of moral and ethical conduct. No matter what methods are in place, the risk of academic integrity breaches will always exist. There will always be naughty students, whether proctoring is used or not. If there's no proctoring, efforts must be made to reduce collusion and contract cheating in particular. So writing questions that refer specifically to aspects taught in the course can reduce the ability of contract cheaters to perform well. Pharmacists often look up information, obviously, on a daily basis. So as Beck said, it makes sense to have open book exam. And as Sarah mentioned, students can apply or evaluate information rather than just regurgitate memorized information, which can improve authenticity of assessment. When writing exam questions, thought should be given to, thinking about ensuring that students that do attempt to gain an unfair advantage by communicating with each other via social media, for example, won't be advantaged, and time limits can help with that. So using reasonable time limits for students to complete the exam, but don't give extra time to potentially collude with others. And they can add authenticity as well, because pharmacists are under time constraints, and just like a pharmacist wouldn't be competent if they had to look up every resource or resources for every interaction with a patient or a healthcare professional, so too can exams be designed that if students have to look up every information for every question, they're more likely to run out of time and fail. And just finally, in terms of exam or question types, what should be used? And that obviously depends on many factors, such as the learning outcomes assessed and the resources for marking. We know MCQs are efficient to mark. As Beck mentioned, for OSCE cases, academic integrity breaches can be reduced by using question banks and randomizing the types and or the order of questions. And finally, just the text matching software is really important as well to detect potential cases of plagiarism of online material or collusion between students. Thanks.
All right, wonderful. Thank you so much. I really love the aspect of making this a normal part of our conversation and putting it back to what their future is as a pharmacist, that it's so important to take that practice, take that professionalism into account. So Vibhu Solanke, can you please share with us really your thoughts on the acceptance of online education, since this is not what everyone has signed up for initially? So.
Yeah, absolutely. Thank you. We've got to that point now, haven't we, where we've just got to get on with it and we've got to do it. But it's really important that along the way we ensure that as academic institutions we engage through this online process in a scaffolded approach to ensure that the student optimizes their learning. Added to that, we also need to make sure that we engage our students, like I mentioned before, in terms of understanding what their engagement might be like. We're at that point where we as universities need to deliver an online training program, and students need to accept that this is what's going to happen in this COVID world. As a consequence, it's going to be really important about how we brand and how we market what we're doing. So students typically who have signed up to a traditional healthcare degree very much expecting a structured experiential learning environment where they are coming up and learning with traditional methods of teaching. So as a consequence, that's very, very quickly changing, and helping students understand that those standards are still there, that experiential learning is still there, but it's been delivered in a different way, in a different format, that marketing approach, and helping those students, particularly traditional healthcare degree programs, those students understand that an online program is not a subversion of or a poorer version of an experiential learning degree program. It's just an addition to, but also there can be significant enhancements and perceived benefits to students by undertaking online learning if we do it in an appropriate way scaffold that learning to ensure that that engagement is there. And that's going to be really, really important, because that engagement level is going to be really important. There's no hard and fast rules, I suppose, with this. I mean, there's lots of research out there. It's a case of your individual institutions and individual academics going out there and really exploring what the key learns are. I mean, there's lots of information about students not taking notes if the videos are too long, are too short, for example, because often enough they feel that if something's under 10 minutes, they can absorb it and learn it instantaneously. But then there's having a video longer than 20 minutes and having an impact on engagement, and understanding that students will be on Facebook and social media, as well as listening to your lecture slides. So it's really important that we start to think about what is best for our particular students, the cultures in which our students are in, and the countries in which we're operating our degree programs within. And I think the other thing is, obviously, this is a real opportunity to refocus teaching around the student. So online, it's going to happen. Let's think about it in the same way that we would think about it in terms of bricks and mortar. So we've got a campus. We try to make our campus look really inviting for our students, to make it really engaging and beautiful for our students. It's really important that our campus recruits people on its own as well as the courses. So let's make a new campus online, make it a community, give it a purpose, give it an identity, so that your students engage with it, so they know that actually they want to go in and learn, even though they're physically not going in and learning. So I think with that structure, you'll have meaning and a sense of, you'll give the students a sense of belonging, that they're a part of your program. And that kind of takes us on to the next slide in terms of understanding about team working. Now, I don't have any on all the answers to this particular one, because we're fighting our way through this at this moment in time, as well as many institutions are. What do we do about our year one support? Those students are coming in from a very different environment. Some of them have been told their exams have cancelled. And so at this moment in time, they're doing nothing. And they're going to come into our institutions very, very rusty, as I'd like to say, in terms of not really having the critical mass and the momentum towards going into higher education and learning. So as a consequence, it's going to be really important that we think about the ways in which we foster teamwork, how we develop that collegiality, and there could be an opportunity to sort of develop what we essentially would call week zero. We absolutely plan for day one, we absolutely plan for week one, and we plan for those subsequent weeks in terms of an online program. But what about week zero? What about getting them ready before they come to our institutions? How about getting them ready as they approach our institutions? And once again, fostering that environment that they belong on this online campus the best way we possibly can. There's ideas of potentially about really ramping up our peer support and mentoring programs. You know, we've got a group of students, whether it's year 2, 3, 4, 5, 6, 7, whatever your programs look like, where there's an opportunity for those established students to really help out those year one students. So at the University of Nottingham, we've got our simulated pharmacies. And so we're very much promoting our virtual world of Pilchester. So our year one students are all going to be registered to one pharmacy, and they're going to be with that pharmacy for the 3 years and potentially be owners of that pharmacy by the time they get into their 4th and final year. So it's just, how do we create that online campus and that online integration into our bricks and mortar institutions? Thank you.
Wonderful. Thank you so much. You're such a good cheerleader for this. I feel like I want to join right in now to your program, but I think these are important points for us to consider. The longer we are in this online environment, we want to keep students coming to our programs to help fulfill our profession. So thank you for that. Dr. Anderson, do you want to please share with us switching gears to some other types of challenges that we may be facing in this world?
Yes, hello. Totally different now, but we were asked to talk about this, the PhD Viva. I know you don't do Vivas in every country, but in the UK and in some other countries, we do vivas. This is the final examination after the PhD thesis has been submitted. And we've had to move that online totally, obviously, during this time of social distancing. At Nottingham, we did have some experiences of doing it online because our school is also in Malaysia. We have a campus in Malaysia. So we have done vivas there over the internet using video conferencing, Skype, and so on in the past. So we do have some experience of this. But now all vivas in the university have had to move online, and we actually use Microsoft Teams in our university. And previously, we didn't have a chair for the vivas. We just had an internal examiner, somebody from the staff of Nottingham, plus an external examiner. And now we have introduced a chair to make sure that everything in the virtual environment works. I think everybody's becoming more and more familiar with the virtual environment, and we're all operating very well today, for example. But just to make sure, in case the examiner isn't familiar with it, to prepare them, to practice, to prepare the student, maybe do a trial run if necessary, and of course to have backup plans. And you need to set up different rooms, different meetings, so the examiners can meet and discuss the student, the chair can prepare the student, the chair can talk to the examiners, and then the student can come in and do the exam. And for those of you who don't have PhD vivas, they're actually all about making sure that the work is the student's own work. So it's very much about that. Okay.
All right.
So again, something totally different I've been asked to speak about. Again, it was something we were asked about. And again, this is just what's happening in the UK, because I can't really comment on what you're doing in your countries, although it'd be very interesting to hear what you're doing. In the UK, students typically do a 4-year Master of Pharmacy program. And then, having graduated from the university, they go out into practice and do a 52-week, a 1-year pre-registration program. And that's accredited by the General Pharmaceutical Council, who are our regulator in the UK. So this year, the exam would normally have been in June, and it would have normally been in large conference venues around the country. They were not set up for an online exam at all. And being a regulator, they had to take very necessary precautions. They couldn't suddenly set up an online exam. It had to be done with great caution. And they decided they couldn't do it quickly enough. So those students who were meant to be doing their exam in June, meant to be coming onto the register by the start of August or before, were not able to do that. So they went back and they decided that the over, I think it's nearly 3,000 students who are going to would have been going to go onto the pharmacy register this year are going to have provisional registration. And they made some rules for that. They have to have been awarded the Master of Pharmacy program and completed their training in 2020. They can't previously have failed a registration assessment. They need to self-declare that they're fit to practice as a pharmacist and that they understand the parameters in which they can practice. And they also have to have a declaration from their pre-registration tutor, their preceptor who's looked after them throughout that year. And they also have to sign up to ongoing guidance from a senior pharmacist. They can run a community pharmacy on their own, be the responsible pharmacist. They can't act as a locum. So there are some different parameters. And the exam will be online, and we're still waiting. We've been told we'll probably know by the end of this month when the exam will be given online, but it won't be straight away. So very different year for these students, but they will in every respect be able to act as pharmacists. They will just be expected to do the exam at a later stage. So I know different countries are doing different things around this.
Yeah. Wow, thank you so much. That is so interesting to see the flexibility and understanding that your regulators are exhibiting there. Very nice. Thank you. Some great ideas there. All right, so in the interest of time, a lot of us, I'm going to take these next slides, and a lot of us have offered thoughts about this, so a lot of this is review. But one of the most important things we need to think about is student support. So we've heard things like peer mentoring and tutoring, where students can help each other, whether it's just mentoring this new world, tutoring in classes. I think we saw somewhere where having some town halls, having some online sessions to check in with your students and each other and see how things are going. That's one of the most important things we can do, all in the spirit of communication. Office hours, or the times when faculty are available. I know I have one faculty member at our school who has a Zoom link up pretty much all day, and students can pop in. So that's just letting the students know that you're still available in this online world. Let's see, and then another thing is to provide access to computers and internet for those that don't have those resources. So perhaps that's something your school can do, is open up a classroom or a library, what have you, and provide internet, provide computers, and of course practicing social distancing. So a lot of ways that we can support our students during these times. We talked in one of our planning sessions about some of the rewards, and I think one of the things that you've seen quite a bit here throughout the presentation is that this has allowed us to really think about our students and to become student-centric, and I think that's probably one of the most important take-homes we can take from this transition. It has also allowed us to streamline our programs, think about ways we can use each other's content and maximize that efficiency, and doing that with our assessments as well. The other thing is flexibility during these times when there's so much else is going on has been key, and this has really allowed us to think of other ways of doing things, and I think we saw lots of examples there. And the next one is it has allowed us to identify where our gaps are. I think we've all quickly learned that there are some things we have not thought about, and so this has allowed us to do that and to be better as a result moving forward. So I just wanted to recap some key resources. We covered this one, the first one, emergency remote teaching and online. In the first one, it just really is a nice article that came out early on about the differences of it, and that's important to consider, especially as we learned today when we're assessing what has happened. And then this one just came out, the faculty playbook came out earlier this week, 2 days ago, in fact, and it is 55 pages of excellent information on how to design your courses in this time, what to think about in regards to equity and so on. So please do take a moment when the slides are available to access those resources. We've also just kind of gone through a large number of these are from Dr. Wingate at Howard University, some really wonderful resources, some articles that have been published. These are really just a few that are out there, but these are some that can get you going on some additional information. So I know that we are up against our time limit, and some questions have been answered. Thank you to our panelists for answering them on the Zoom chat. I do believe, and maybe Dr. Tafade or Mila, you can guide us. Do we still have time for some live questions?
I think that we've answered most of those questions through the portal, and thank you so much, Sean, for such a fantastic moderation of the panelists, and thank you so much to the panelists. There is one question that I think, or two, that have not been addressed fully, which I believe Sarah and maybe Vibu can assist with, or perhaps Dan, and that is regarding curving the grade or norm referencing, depending on where you are in the world. Would you be so kind to address that to the panelists, the attendees, please? Sarah?
Go ahead, Dan.
No, you go, Sarah.
Okay. So I kind of listed it, but basically, so there's a couple different words for curving, which I'm also learning myself. So norm referencing is another thing, and then kind of like percentile scoring. So it's essentially where the highest So this, like, the student that gets the highest score sets that curve. So basically sets, if the highest score on your exam, it was a tough exam, was an 85%, then that student essentially gets 100%, and all the other scores sort of follow suit. And so the issue with that is then if, so it sort of puts students up against one another, because those students have to do well, and it depends on how other students do. So if other students do poorly, then that sets the bar lower, and students will individually do better, essentially. And so so that's something that we, would sort of suggest not doing, so that the responsibility really falls on the individual student, and they're not forced to, cheat in order to sort of keep up with the rest of the class.
I completely agree with that, Sarah. We don't do norm referencing at Monash. Criterion referencing is the way to go, because we're looking at the ability of students to do particular activities to either learn or remember things, or apply or evaluate information, and we want to set the standard at a particular level. And for norm referencing, you're not setting the standard at a particular level. You're putting students against each other, which is I don't think the way to go.
Excellent. Thank you so much. The other question here that has not been addressed, and we want to thank everybody for calling in and participating from all over the world: India, Bolivia, Tanzania, Philippines, Nigeria, Iraq, all over the UK, Australia. We thank you, thank you, thank you. There's a question here from Jill Boone, Cincinnati. When early learning students shadow or observe pharmacists in practice, is there a way to do this remotely during this time for the students to gain better understanding of practitioner roles? What suggestions might you have for remote shadowing?
Sarah, I'm wondering, you've had the opportunity to do remote precepting, haven't you?
Yeah, so it sounds kind of funny, but we actually will bring students on rounds with us. So we we have a little cart with the laptop, where we just carry the laptop. And so for certain great conversations and how they're kind of seeing us interact with the team, I practice in internal medicine on the inpatient side. And so we actually will have students watch that environment. And then we'll kind of go back to them, and we'll talk about later kind of about that kind of interacting, so that they can kind of have that modeling. So that's been helpful.
Excellent. Nohad Alamari from Iraq is curious about platforms for Google Classroom platform, and whether it's suitable to limit students cheating. I'm not familiar with that platform. I'm familiar with ExamSoft. It has a exam ID and exam monitor portal through which you can actually monitor the student, and it has worked really well at Howard University. Anybody able to speak to Google Classroom specifically?
I don't know. I've heard of it, but I haven't had the opportunity to even dig into it.
Okay. I also wanted to mention, because I know there are a few questions about doing experiments remotely. There are some experiments you will not be able to do remotely, and we could suggest to FIP to really discuss research and how it's being impacted and what kinds of things we might want to consider. I think the only other question left here for us to wrap up is somebody would love to ask, and Osama would like to ask, how to replace lab sessions, hospital and community attachments. I'm sorry if you missed the experiential webinar, which we had, was it last week or the week before?
Yeah,
it is available and
ago.
was recorded, actually. So on the FIP portal, and Mila will be kind enough to share the link again for everybody to see, where you can access all these wonderful information for you to be able to go back and review. And just as a reminder, this session has also been recorded, and you can access it for free, so that way you can see some of the detailed responses. We want to thank everybody for for participating. And I would like to remind each one of you that we have a survey at the end of this webinar for you to please give us your feedback. We again recognize everyone from all over. I think somebody from Nigeria has reminded me that you weren't called. Thank you so much, everybody from everywhere in the world where you joined us. We thank you. Without you, we will have no webinars, right? So you are very important. Thank you for joining from Canada. Oh, look, all the shout outs are coming. Awesome. We had about 163 so far here participating. I'm sure some people had to log off for specific reasons. Thank you, thank you, thank you for calling from around the world. And we look forward to have you joining us next time. Sean, fantastic job, ma'am. And for all the panelists, what an awesome work. It's such an honor to have the opportunity to be in the same space with brilliant colleagues from around the world. Thank you, thank you, thank you, thank you.
Absolutely. A big thank you to all of them. They have been working on this for the last couple of months and sharing lots of emails and Google Slides, Google Documents. Thank you, everyone, for sharing your expertise and learning, teaching us all, and hopefully we all had the opportunity to learn from each other. So Dr. Tafati, thank you for your excellent moderation again. It is a pleasure as always. And again, the survey feedback survey has been provided, I believe, and the COVID webinars are on the website. So thank you, everyone.